Welcome to the City Club of Eugene's July 23rd, 2021 program, Who Cares for Kids? Lane County's Child Care Desert. This is the 41st program for our 2020-21 programming year. My name is Kitty Piercy and I am the City Club President. Support for the City Club is provided by our members and sponsors. You can become a member of the City Club at our website, cityclubofeugene.org. Our programs are always available on our YouTube channel and on Facebook page, and our broadcast on public radio station KLCC 89.7 on Mondays at 7. We have both business and in-kind sponsors, including our diamond sponsors, Kaiser Permanente, University of Oregon, Peace Health, and Lane Community College, as well as generous support from the City of Eugene and from Lane County. In today's program, we welcome Alyssa Chatterjee, Acting Director, Oregon Department of Education Early Learning System, Cindy Bellamy, Director, Oak Street Child Development Center, Cheryl Henderson, Manager, Lane Community College Child and Family Education Program. Biographical information on our speakers is available on our website, cityclubofeugene.org. I would like to thank Karin Knudsen for coordinating today's program. So thanks, Karin. Recently, OSU published a new report titled Oregon Child Care Deserts 2020. And as anyone looking for affordable care in Lane County knows, the news isn't good. Lane County does not have enough child care spaces available for its infants and toddlers, qualifying our community as a child care desert, meaning that for every 3 children under the age of 2, there is only 1 child care space available. The lack of available, affordable, quality care impacts every family and local community at large, but hits moderate and lower income families particularly hard. Policymakers have openly observed that for many families, it's housing or childcare. The annual cost of care in Oregon is more than in-state college tuition. Think of that. Oregon has the 4th highest childcare cost in the nation. Think of that. But sector leaders also acknowledge that most childcare centers operate on razor-thin margins. The labor-intensive industry is largely subsidized by the low compensation of its care providers, most of whom are women, and particularly women of color. Intensive work and low compensation are not a recipe for new workforce recruitment, which makes childcare even more scarce and competitive. What can be done at the local and state level and even national level? Our speakers today will illuminate Lane County's unique local challenges and opportunities, as well as possible solutions from a variety of perspectives. Our format today includes a question and answer period with city members via Zoom. I look forward to this program myself because I've been involved in early childhood for a long time, and in the whole question of the economic costs of childcare in our state. So I'm looking forward to this.
Hi, my name is Alyssa Chatterjee. I am the Acting Early Learning System Director with Oregon's Early Learning Division. And I just wanted to share a little bit more about Oregon's child care system. Oregon's child care system, like many systems across the country, is very complex, and it's a system that's largely funded by parents and families. OSU's recent Child Care Desert report is the second report and since 2018, that's giving us a look at what our childcare supply was right before the pandemic hit. Right before the pandemic, we saw that 11 counties are childcare deserts for preschoolers ages 3 to 5, and that the entire state qualifies as a childcare desert for infants and toddlers. So we only have 1 slot for every 3 children at least in that age range, and that number is much higher for infants. But we've also found that even more counties would be deserts for our preschoolers without public funding. This is particularly true for our rural communities, where public funding has had a significant impact on building the supply of childcare. But the pandemic has really only heightened this crisis. Low wages and high turnover contribute to a workforce that's difficult to recruit and retain, and it's a field with little or no benefits like health insurance or retirement. It also creates a tension because while we know childcare is increasingly unaffordable for families, it also creates very little opportunity for childcare providers to earn a living wage. These childcare providers are our early childhood educators. They're experts in their field, deserving of compensation. And we have a few levers at the state level that we can really start to utilize to help address this crisis across the state. The first is through childcare subsidy rates. So we have a program called Employment Related Daycare that is focused on providing childcare subsidies to low-income families up to 250% of the federal poverty level. This allows us to reduce the out-of-pocket cost to those families while simultaneously ensuring that providers who accept the subsidy have a reliable income stream. We also are able to quote unquote, buy contracted slots. We're able to look at programs that would basically cover the cost of a child, even if that slot is vacant. This also allows us to have impacts on things like creating a living wage, working towards benefits to support providers. As we think about childcare, we've known for decades the important impacts that early years from birth to 5 have on a child's overall development, growth, and success. But the pandemic has really highlighted for a lot of folks the critical role that childcare plays as an economic infrastructure support. We've been hearing even before the pandemic hit about the workforce impacts for businesses having difficulty recruiting and retaining staff due to the lack of childcare in their community. And as we enter into economic recovery coming out of the pandemic, we're seeing that this economic crisis is disproportionately impacting women as they're staying home to care for their children due to the lack of access and care. We've heard from families through the pandemic that they've seen increased costs in an already expensive service of childcare, causing families to have to make a decision about whether they can return to the workforce, if they can even find care in their neighborhood. We've also heard concerns from families who are anxious to get their child back in childcare for the socialization and child development and growth opportunities that they can be afforded in these settings, and making sure that our families with children experiencing disabilities don't fall further behind. We have also seen that employers are starting to have an increasing understanding and awareness of the impacts of childcare. And we've heard from parents that they'll receive advice from employers to start looking for childcare a few weeks early. And we all know that so many families experience wait lists of a year or more before they can find childcare. In spite of that, the Early Learning Division, which oversees several components of our early learning system, have an opportunity to hopefully make some impacts to childcare across the state. The Early Learning Division oversees licensing for childcare programs from birth through age 12. This includes monitoring for health and safety, investigating any complaints, and ensuring that our kids are in quality settings across the state. We also administer early learning programs for birth to 5 children. This includes Head Start, Oregon Pre-Kindergarten, Preschool Promise, and new programs like the Early Childhood Equity Fund or Parenting Education. We also have home visiting programs like Healthy Families Oregon, and work to really provide supports to the whole family and whole child. We've recently seen some opportunities to see investments in professional learning. In 2019, the legislature made one of the largest investments in early learning in its history with the passage of the Student Success Act. This sees over $200 million a year being dedicated solely for early learning supports, including creating a professional learning system to help recruit and retain this workforce and be able to grow wages over time. We've also been working very closely with the Oregon Department of Human Services to set policy changes for our childcare subsidy programs in an effort to really help families access more childcare. Through the pandemic, we were able to make some really significant changes. Prior to the pandemic, Oregon had some of the highest copays in the country. So while we may be number 4 overall in terms of how expensive childcare is across the state, we were actually in the top 3 for copays. So our families that are eligible to receive subsidy dollars were paying a much larger out-of-pocket cost than families in other states. We were able to actually suspend copays through the pandemic, allowing providers to again have that more reliable source of income and allow our families to target their resources to things like housing and some of the other critical supports that families need to thrive. Coming out of this pandemic, we were fortunate to see some exciting legislative changes that will help some of these kind of COVID-19 policies have a more permanent trajectory. The first was House Bill 2166. This, among several things, creates an early childhood suspension and expulsion prevention program. We know that children are removed from childcare and early learning settings, and often this looks like what we call soft expulsion. It's not an official designation like it might be in the K-12 system, but we'll see providers suggest that a child only come part-time, or they often call the family to pick the child up, to the point that the parent might actually withdraw the child from the program. We also know that this is disproportionately affecting our kids of color and our kids experiencing disabilities. So we are looking to create a program that would provide assistance and support to families and providers. So we could connect families to referral services if their child may actually need some intervention. We also can provide technical assistance and training to childcare providers. Often what we've found in looking at other states that have implemented similar programs is an opportunity to really just help create developmentally appropriate expectations and helping providers understand the environment that children come from. And in many cases, looking at this through a culturally responsive lens. We also saw the passage of House Bill 3073. This legislation includes changes to the child care subsidy program to increase eligibility so more families can access subsidized childcare, and it also would cap copays so that no family who's eligible would pay more than 7% of their income. We are also excited to see that this would create a new Department of Early Learning and Care, allowing the Early Learning Division to separate from the Department of Education and stand alone as its own agency focused on birth to 5 programming in particular. Oregon's been fortunate to receive financial relief through the pandemic, which has been used to reduce copays for families through 2025. It's also being used to provide direct assistance and supplies to providers, including over $220 million that we'll be able to start releasing to providers in the fall. We're able to fund some additional technical assistance to recruit and retain our workforce. And we have an opportunity to increase the amount of funds that our providers will receive through subsidy. Oregon has invested in a model through state investments that really supports family choice by funding programs in homes, schools, centers, and community-based organizations. We have the opportunity to see continued expansion to access of these programs with the latest legislative session, giving us over 6,000 slots or families served if we see full funding of that expansion. This would fund programs like Preschool Promise that can fund home-based and center-based programs. It'll see expansion in parenting education, home visiting, relief nurseries for families in crisis, and it also will include some wage parity opportunities so that our providers in these critical functions are able to earn a living wage. So that's an overview of kind of the division and some opportunities we see ahead, and I will turn it over to Cheryl Henderson. Thank you.
Hi, thank you. I'm Cheryl Henderson, and I am the manager of Child and Family Education here at Lane Community College. In this department, is housed the Lane Child and Family Center, which is a child care center for children ages 30 months to school age up to kindergarten. And also included in the department is Quality Care Connections, which is Lane County's child care resource and referral agency that is funded through the Early Learning Division. So before I start talking about childcare, I want to talk a little bit about children. Children are born ready to learn and have many skills to learn over many years. They depend on parents, family members, others, including childcare providers, to develop the right skills to become independent, to lead independent and healthy lives and be successful. And how the brain grows is strongly affected by children's experiences with other people in the world. Nurturing care for the mind is critical for brain growth. Children grow and learn best in a safe environment, which is why quality childcare is important and why I asked the City Club to choose childcare as a topic. I first want to quickly go over the types of childcare and the numbers specifically in Lane County. In Lane County, we have about 54 current license exempt providers who can provide up to care for up to 3 children at any one time. Then the next level is registered family childcare. We have about 82 registered family homes in Lane County, and they can provide care in your home for up to 10 children, including your own, at any one time. The next level is certified family childcare, and there are more differences and similarities in the care, but then I have time to describe today. There are about 69 certified family homes in Lane County currently, and they are able to serve up to 16 children at any one time, depending on square footage in their home that is accessible to the children. And then most people, when they think of childcare, think of licensed centers. We have about 90 licensed centers in Lane County serving a range of numbers and ages of children. And Alyssa already talked about all the public programs that exist in Oregon for children. But in Lane County, the current total capacity in childcare for children birth to age 6 is about 10,367 slots. Currently, and again, this is hard to find exact numbers, there are about 25,000 children in Lane County under the age of 6. So and then there's a whole vacancy system. The current vacancy list in childcare that we know is about 1,190 slots. That number is not correct, and we know that because Quality Care Connections staff is required to get current numbers and up-to-date numbers, which is a bit of a feat to get responses from providers, and the numbers change all the time. Parents change and providers change. So that number we know is not accurate, but we know that meeting the needs of over 25,000 children can't be done with just over 10,000 total slots. We know that infant toddler childcare in Lane County is a desert, but we also know that preschool and school age care is still lower. The numbers are still lower than the needs. So City Club chose to call this episode Childcare in a Crisis. I want to talk a little bit about the workforce and why we're in a crisis. Alyssa mentioned low pay for hard work in childcare. We know the work is rewarding yet exhausting. The workforce dropped immediately at the start of the pandemic with many childcare closing initially, but the workforce has not recovered. It is especially difficult to find infant toddler care, evening and weekend care, and childcare for children with disabilities. And when we think about it, even families who have 2 working parents, they are young and at the start of their career, and therefore their salaries are lower. And when we compare that with knowing that quality childcare in Oregon costs more than current in-state college tuition, that we know then this is a big issue. Alyssa talked about work that the Early Learning Division is doing, and I wanted to add that there have been emergency childcare funds throughout the pandemic to support childcare. There is current incentives for childcare providers to, once they go to higher levels of training, there's actually cash incentives for them to receive. So now I want to talk a little bit about what Quality Care Connections is and is doing in Lane County. They're housed here at Lane Community College, but funded by the Early Learning Division. And the mission of Quality Care Connections is to promote equitable and accessible services and support to early learning professionals, ensuring that children and families in our community thrive. We are definitely known for the trainings we offer, and these trainings help providers meet licensing requirements for training. On staff, we have a multicultural specialist for providers who speak Spanish, because we have around 30 providers who Spanish is their primary language, and we have many providers and childcare workers who are bilingual. We have several quality improvement specialists on staff. Several work with a network, which is a group of providers who are kind of wanting to enhance their childcare work in a specific area. So currently we're running a business network for small family childcare providers, an infant toddler network, as well as a leadership network for center providers. We answer a lot of questions and provide a lot of consultation to support retention of childcare providers in Lane County. We also provide scholarships for childcare providers who are going to pursue their associate's degree in early childhood education. It's great that we're housed at Lane Community College, and I work a lot with the early childhood education program and the faculty. There's now option to get credit for prior learning to support the providers to pursue their education. Quality Care Connections worked with Lane Community College to provide a vaccine clinic specifically for childcare providers at early on in the vaccine efforts. Currently, we're trying to help childcare providers find staff to apply for the jobs. There are currently 17 childcare providers in Lane County alone advertising positions on Indeed.com. We're reaching out to all providers to kind of make a huge advertisement and posters that say childcare workers needed. That's where we are today. The YMCA alone has over 50 positions they need to fill before school starts to provide after school care. So local potential solutions. I am excited to be on City Club because I want everybody to talk to their friends and family and neighbors to talk about what you can do to affect the childcare deserts in Oregon and Lane County. I want to do a specific shout out to any parents or grandparents who are home during the day or evening or weekend that might be willing to even serve 3 children in their homes. Any business owners or government agencies that have any space that they are not currently using, you can call us at Quality Care Connections and we can reach out to providers and maybe they would open a second location, or several providers already have more than one location and could reach out and provide childcare in another location. Rent hugely affects the quality of childcare. So as you can imagine, salaries is the #1 budget item on a childcare budget. If you also have rent, and some childcare programs are paying $4,000 a month or higher in rent, the effect of what they can pay for high quality teachers is hugely affected by rent. So any leases of space at reasonable or affordable prices for childcare, please reach out to us. We'll help you get get childcare happening in that space. Any employers who are interested in providing employer-sponsored childcare or on-site childcare, please give us a call. We'd love to talk to you about that. I mean, a dream of mine were to be if the city of Eugene or the city of Springfield or anywhere would consider having childcare options be zoned in new developments or be a part of zoning new developments or permitting them. I know the Early Learning Division is talking about how to increase salaries and make childcare a profession that you can make a livable wage in. Quality Care Connections, we've been reaching out to a private local donor talking about the potential of signing or retention bonuses, just like nurses are given currently and is a need in childcare as well. I think we'll give out our contact information through the City Club as well. Again, I really am thankful that you chose this topic, and I'm glad to be part of the panel. And I will pass it on to Cindy Bellamy. She's been in the field for a long time.
Thanks, Cheryl. Hi, I'm Cindy Bellamy, Director at Oak Street Child Development Center, a nonprofit child care program located in downtown Eugene's Market District. I would like to thank the City Club of Eugene for this opportunity to talk about the child care desert in Eugene, our state, and our nation. I'd like to start with a little bit of history about our program that serves children 6 weeks to 5 years of age. Lane County Commissioners considered creating a child care facility for their employees in the early 1980s, but it wasn't until a joint ASFE County Labor Management Child Care Committee was formed in November 1987 that the feasibility of establishing a child care facility for county employees was examined. After conducting surveys of Lane County employees, there was clearly enough interest to proceed. In April 1989, the Child Care Task Force was formed to plan for the establishment of a downtown center. A joint venture between Lane County and the federal government began soon after, when the Forest Service involvement was inspired by strong employee interest and federal legislation that encouraged the creation of federal child care centers. A parent planning group of county and federal employees met on a regular basis to provide input on key planning decisions. The parent planning group, in conjunction with the task force, contributed to the preparation of a cost-benefit analysis. In March 1990, Lane County purchased the bus barn and adjacent Oak Court buildings. The Forest Service agreed to lease half of the center, pay for half of the remodel over the first 5 years, and provide startup equipment and furniture. Parent fees would pay actual operating expenses. In April 1990, a nonprofit organization, Busy Barn Incorporated, was formed to assure the provision of affordable and quality child care for children of Lane County and federal government employees and other children as space allowed. The volunteer nonprofit board issued a request for proposal to operate a county federal employee child care center, interviewed potential operators, and in 1990 signed a contract to begin center operations. A 3-way contract was also signed by BBI, Lane County, and the General Services Administration. The center was dedicated November 26, 1990, and included Lane County Commissioner Bill Rogers and Congressman Peter DeFazio among those attending the celebration. Governor Barbara Roberts and GSA Director of Child Care and Development Programs, Alaire Williams, later visited the center. On January 2, 1991, the cheerful voices of children filled Oak Street Child Development Center. It didn't take long for Oak Street to establish itself as a quality center. By May 1991, the center was nearly full to capacity. Since then, Oak Street has operated at or near capacity. Throughout its 30-year history, the parent board contracted with different organizations to operate Oak Street, including Crest Kids Club, the Eugene Family YMCA, and Easter Seals of Oregon. Since January of 2002, Oak Street has been a board-run center under the day-to-day direction of myself and has no longer needed outside assistance for administrative services. Located in Eugene's historic market district, within easy walking distance of parks, the library, and park blocks, Oak Street Child Development Center's annual budget is approximately $550,000 and is generated by tuition collected by families. We employ 18 to 20 people. In the past, we've been able to provide these employees benefits, including health insurance, paid vacation, sick leave, and paid parking and transportation passes. Health benefits have become cost prohibitive and are no longer provided. The facility provides care for 50 children, including up to 8 infants. Oak Street does not now and has never received a general fund subsidy from any sponsoring agencies. Oak Street Child Development Center is known for its stability of its staff and for the quality of the program. Its curriculum reflects the National Association of the Education of Young Children's philosophy that high-quality early childhood programs provide a safe and nurturing environment that promotes the physical, social, emotional, and cognitive development of young children while responding to the needs of families. High-quality childcare gives employees the peace of mind that they need to continue to be effective and productive in their jobs. Our program continues to be full and has an extensive waiting list of over 30 families. We receive phone calls every day inquiring about care, mostly for infant and toddler care, which is exceedingly difficult to find in our community. To be placed on our waiting list, a family must come in for a tour and pay a $50 fee with no guarantee of ever getting space in the program. Over the years, the program has attempted to expand many times so it could provide more childcare space in our community. We're in the process once again of remodeling office space in the Oak Court building that is connected to our building that has been vacant for many years, and are hopeful that Homes for Good as our lessor we will be successful in completing the project. Money has always been the determining factor, along with maneuvering the complex permitting process that is required by the City of Eugene. Childcare space is very specialized and requires overhead sprinklers and other modifications not usually thought of in renovations. The childcare desert is not just an issue in our community, but one that expands throughout the state and our nation as well. During the pandemic, it became more apparent that something needs to be done. Senator Ron Wyden visited our playground recently to speak on this issue, and along with Senator Elizabeth Warren is backing the Building Childcare for a Better Future Act, which was first introduced in late May. The bill calls for $700 billion in spending and prioritizes funding for establishing neighborhood-based childcare, renovation of childcare facilities, recruiting staff, increasing worker compensation, and funding childcare development in low-income communities. If we're successful in adding more space for care, we would increase our capacity by approximately 10 spaces in the first phase and possibly up to 50 more spaces in the second phase of our expansion. But more spaces means more teachers and caregivers, which have been hard to come by. Childcare workers are among the lowest paid workers in ours and any community. We are overworked and underappreciated in many ways. Unless a program has ties to a college or university, compensation for childcare workers relies primarily or solely on tuition charged to families. Current tuition for a full-time infant at our program is $1,452, and it goes up to $1,543 in September, mainly to keep up with the minimum wage increase we experienced in July. Something must change. I'm part of a director's organization called the Oregon Association of Early Learning Professionals that supports and helps to train other directors in our state. We have worked for many years at changing the stigma of our profession. Yes, child care and early learning providers are professionals, not babysitters. We have college degrees and attend trainings required of us by the state to continue to be able to provide care to our most vulnerable population, children. I encourage all of you to look deep down into yourselves to see what you can do as a business or as an individual to help support the effort to change the childcare desert into an oasis of childcare choices for generations to come. Thank you for your time, and now we will have a chance to answer any questions you might have.
Thank you to all of our speakers today for sharing those insights to Lane County's childcare challenges and also possibilities for what we might do to address those challenges. Our first question today is from Kristen Helton of LCC's Child, Family, and Education Department. Specifically, she is a quality improvement specialist. Kristen.
Hi, thank you for allowing me to ask the first question. I'd also like to just give a very quick background that I was a childcare director for 15 years. So I have a lot of direct experience behind me. And in fact, Joel Corin's granddaughter was in my program. And while I try to remember all of the children's names that I run through my program, I don't remember Joel's granddaughter, but it's nice to see Joel again. So we heard a lot about the issues that are facing childcare providers. These are systemic, these are not overnight fixes, and they're national issues. And I can reiterate all of them, but I think we've heard them already. My biggest concern comes from the childcare directors that I speak with every day, and that is that there is a severe teacher shortage at the moment. We cannot expand childcare programs if we don't have teachers to teach. Programs can't reopen or open classrooms if they don't have teachers. And what we're seeing is we know that there's always a teacher turnover in early education and childcare, but it's getting worse. So faced with a lack of teaching staff, programs close classrooms or and increase teacher to child ratios, which greatly impacts quality. When quality is impacted, teachers aren't enjoying their experience at the pay rate that they make and the lack of benefits, so they leave the field. It's a vicious cycle. So I want to know, where have all the teachers gone and what can be done to encourage people to rejoin the field now or to join the field in the future? And specifically, how can our local governments and our business community help with this situation?
Alyssa, and then Cheryl, and then Cindy, please.
So I would say, to your point, Kristen, it's definitely not an overnight fix. But I think, as we've seen with a lot of other low-wage fields, you can make more money at Target or at Starbucks than you can in childcare, and the work isn't going to be as physically and emotionally draining as the childcare field is. I think. We know that we saw a lot of our workforce detach when the pandemic first hit. Cheryl mentioned just, the plummet we saw, especially because a lot of programs closed and a lot of that workforce is not coming back. We have seen investments through some of these federal recovery dollars and then through state investments to be building our professional learning system so that we can start to create clearer pathways that need to be linked, of course, to wages. As folks continue their education, we need to make sure that they're actually seeing that return on their investment for themselves, and that takes time. I think the other thing that we're trying to balance at the state level is, how do we continue to build supply without compromising health and safety, since we know that the experience and education level of providers has a direct impact on the quality experiences that kids have. The last thing I would just mention is that we are also waiting to expand programming through this latest legislative session investment, and for programs particularly like Preschool Promise that can be implemented in home-based and center-based programs, they do have that living wage component, so it requires parity with K-12 levels of compensation. And so we typically do that mostly in the second half of the biennium. So for folks who aren't familiar, we get funded in 2-year cycles. So most of this expansion would happen in the 2022 to 2023 program year. But that's another really strong opportunity we have to be investing in these programs and ensuring that wages aren't the barrier to expanding.
Cheryl and Cindy, other thoughts as to where all of the childcare providers have gone?
Well, I would add that there's still a risk of COVID to childcare providers, and people kind of forgetting that a little bit right until the vaccine is eligible for younger children. I forgot to wear my Lane Child and Family Center hat earlier as well. I mean, I have quality staff. We run a lab school, but my staff are eligible for benefits as other Lane Community College staff are, and I can afford to pay them a livable wage because I don't pay rent on the facilities here at Lane. But my staff come here every day and are continue to be at risk to get COVID, even though they were eligible for the vaccine pretty early on as childcare workers. But children are unpredictable. So I think that, working at Target is still safer right now, and we're not recognizing that enough. And since I have my Lane Child and Family Center hat on, I'm going to say one more thing that I forgot to say, that I'm also working on trying to get zoning and occupancy changes at Lane's downtown center to provide additional childcare there, because I know we provide quality for all the reasons I've just stated, and why we can do that. But it's taken me a lot of work, and Cindy touched on this as well. It's taken me a full year to get those changes to happen with the support of the facilities department here at Lane, and the ability to pay the initial architect to make those changes. But it's a lot of work, and maybe I'll be able to provide care for 16 more children. But it's something. But anyway, I think the risk of COVID continues with the low wage has kind of put people who might have been willing to work with children and interested kind of not at the forefront currently. Thanks.
I think my biggest challenge is finding teachers. And we strive to have teachers who have degrees and who have lots of experience in childcare working in our program. We've always been very proud of the fact that we are able to be better than state ratios usually for our programming. Since the pandemic, that hasn't been as easy to accomplish. We have some teachers who are actually leaving our program because lives are changing, and that's generally why we have the turnover that we have. I have 2 staff who've been here for 30 years. They've never been paid really a living wage, and both of them have support from outside agencies to be able to continue with their families. Preschool Promise, I think, is a worthy program. The issue that childcare providers, private childcare providers, find is that the teachers who teach the preschool Promise classroom gets the living wage, but the other teachers that are continuing in the program in the other classrooms, that wage doesn't go over to the rest of them. And so that's challenging for me. It's challenging for me to have a program that's federally funded when the whole program is not federally funded. So it would be nice to see how that could benefit a whole program instead of just a specific classroom in the program. I think there are other challenges as well. I mean, space is the big issue. Like I said before, we've been trying to expand for a really long time. We've actually had floor plans written up. We've had architects drawn up plans for us, and then the project's fallen through. This has happened more than 5 times. I'm really trying to be positive about our expansion possibilities. And so, but again, finding the teachers to work in those positions are challenging. And even right now I have 4 teacher spaces that I need to cover. And I, as the director, and my assistant and office associate, is also stepping into classrooms to make sure things are covered.
Thank you. Our next question from Joel Corin, I believe, for Cheryl Henderson.
Thank you. My question deals with what are the requirements to become a provider? Do the providers need to know child CPR? Do they need a special education type of commitment or degree? Just what does it take to open up a facility?
I think I might let Kristen answer that question and talk about family versus center opening. Okay, Kristen?
So child care providers, a high majority need to have CPR and first aid. They need to have a food handler's card. They need to have a class in recognizing and reporting child abuse and neglect, a class in infant safe sleep. They need to take a class every year on childcare health and safety related topic. And all childcare providers need a certain number of hours of training, of which each year, or 2 years if you're a registered provider. A majority of those hours need to be in child development, but they could also be in personal, professional, and leadership development or program management topics as well. It's pretty stringent. It's one of the things that we do at Quality Care Connections to ensure that providers have all of the things that they need. They also go through a pretty stringent background check to ensure that they are safe and appropriate to be working with children. Sometimes those background checks can take weeks to get back. Typically, it's a few days to up to 2 weeks. And that can be really hard to get a new teacher on board if we haven't heard back from their background check.
Thank you. A third question today from City Club President Kitty Piercy.
So just listening to you, first of all, thank you. I really appreciated hearing your comments, and a lot of it seems very familiar. This is the thing I'm thinking about. Businesses all over this community have shortages of workers. I don't know how much of that has to do with childcare. I don't know if that connection with the Chamber of Commerce or businesses is being made, and whether there's some innovative thinking going on about how you get the business community to invest in childcare more as an entity and not just for their personal needs, so that they see that what can get the economy back on track is childcare, and that is connected to wages and all those things you've been talking about. So it feels to me, and I just want your response to this as you think about it, it feels to me like an opportunity sitting there to put some new connections together and try to change the way people look at childcare and why childcare is important to them in the business world and to the economy. So those are just the things that are in my head right now. On one side, I feel very strongly about women's employment. I feel very strongly about high quality care. All of those things but I'm just trying to think of a new window that this crisis has opened up that might elevate the discussion and the support for high quality childcare, including that it's not just care, it's really preparing children for the future. So that's for anybody who wants to pick it up.
Cheryl, let's start with you, and then either Cindy or Alyssa or Kristen, please follow up.
Yes, we are definitely looking for creative solutions and have relationships with, everybody. I am on the Early Learning Alliance Governance Consortium that's been talking about it a lot. And Beth at United Way just spoke to the Florence City Council yesterday. I think building bridges is great. I think it's I think when childcare is recognized to be as important as school age schooling, that will help a lot. And that can come from both ways, recognizing it or creating the supports to pay childcare providers and early educators more on the same range as school teachers. I'm all in and look forward to working with any partners that are interested. And I'll hand it to Alyssa and Kristen.
Thanks, Cheryl. I'll just be quick. At the state level, we do hear about kind of innovative approaches that different regions and communities take. Ones that stand out to me, the Bend Chamber of Commerce has identified childcare as a priority for their community. They've funded a childcare navigator to help the community work through licensing requirements, quality opportunities, connections with the early learning hubs and childcare resource and referrals. We've also seen businesses like Boardman Foods in Eastern Oregon step up and launch their own childcare facility. It initially was started just for employees, and after hearing the need in community, they were able to expand to provide infant toddler care and add a preschool classroom. So I do think we're seeing businesses identify this as a real need. We're hearing businesses identify that there's a difference between giving employees a voucher or funds for actually provide childcare, because the funds are great, but if you can't find a place to leave your child for care, then they can't do much help. So I do think we're starting to see more and more of that. And I think that's also contributed to the support we're seeing from the legislature, because this has emerged as a bipartisan issue, because everybody's community is crying out for support.
I just wanted to say that I've heard a long time ago that if a child is in full-time childcare from birth to age 5, that they spend more hours there than a child does once they have 12 years of public school. So children are spending more time in childcare than they are spending in public school care. We need to invest more in our child care programs. I mean, that's the bottom line. And I think all of us here know that and are on that page. It's just we really need some help from the community to be able to continue providing quality care and education to our youngest children before they enter public school. They learn so much.
So I just want to add one piece to this, and that is having spent 12 years as mayor, I know that our council and our Lane County Commission and even our school board don't necessarily look at this in the way they need to look at it. And connecting those pieces together is really a serious part of building that support that you're talking about, and getting people to really understand the fundamental level of concern that we need to have for what's happening to our youngest kids in our community. So I'm just suggesting that that might be something that could be done at the very basic level. And you've got 2 new with kids, school board members that could be leaders on this issue too. So just
Very interesting points. And we have time, I think, for one last question today that builds on a few of the issues just raised and some of your comments. Alyssa, you mentioned that the Early Learning Division will be separating from the Department of Education and becoming its own area of focus and advocacy at our state level. And in the conversation about the first 5 years, I think, many people in community, many parents, certainly, I think most parents are well aware of just how important that time is in a child's life, how critical pre-literacy, early literacy, socialization is to arriving ready to learn in kindergarten and to succeed through elementary school. But that is really where the focus of our public efforts begin, right, in kindergarten at the end of the first 5 years. Could you talk a little bit about whether or not we're just missing the window and if that's just too late?
Absolutely. I do think as families are definitely aware of the importance of these early years, we are seeing that awareness, from the federal level, and I think with state legislatures and leadership as well. And that's what really contributed towards the creation of a Department of Early Learning and Care coming up in the next year or so. But yes, I think, more and more we're able to show that the return on investment, if we're able to start supporting kids and families early, is significant. And I think we've seen the hope is, and we've already seen this partnership, there is an awareness and understanding and support of that perspective at the state level with the Oregon Department of Education. And so I think more and more we're seeing those community relationships build so that school districts are partnering with providers and local community-based organizations to help grow that supply. And I think we're seeing a direction at the federal level as they talk about universal preschool and other programming to be able to start to expand access to families in the coming years.
Thank you all so much to our speakers today, Alyssa Chatterjee, Cheryl Henderson, and Cindy Bellamy, who have helped us to understand Lane County's childcare crisis and what we might do about it. We will look forward to seeing you all again at our next City Club of Eugene. Thank you so much.
This has been our July 23rd, 2021 program, Who Cares for Kids? Lane County's Childcare Desert. Before we proceed, I'd like to recognize our diamond sponsors. First up is Kaiser Permanente. Kaiser Permanente exists to provide high quality, affordable healthcare services and to improve the health of our new members and the community we serve. More information at www.kp.org. Support comes from the University of Oregon. Since 1876, U of O has helped Oregonians question critically, think logically, reason effectively, communicate clearly, act creatively, and live ethically. More information at uoregon.edu. Peace Health is proud to serve Eugene, Lane County, and beyond. As your hometown healthcare partner for more than 80 years, our mission is to keep you and your family healthy. Learn more at peacehealth.org. Lane Community College transforms lives through learning. Lane Community College provides comprehensive, accessible, high-quality education programs that promote student success. For more information, visit lanecc.edu. I would also like to acknowledge our Ruby sponsor, Johnson & Johnson, Lucas and Middleton. Support for the City Club comes from Johnson & Johnson, Lucas and Middleton, a team of experienced, compassionate attorneys fighting for justice. If you have been seriously harmed by wrongdoing and need help, contact us at justicelawyers.com. One of our staff buyer sponsors, Bennett and Dean Real Estate, is a full-service real estate brokerage in the Eugene Springfield area and offer a comprehensive range of services for clients who are looking to buy or sell a home within Lane County. Our experienced, knowledgeable, and informed team has a reputation built on performance, trust, and honesty in every aspect of each property transaction. And our gold sponsors, Jerry Diethelm, Landscape Architect, and AARP of Oregon. Before we thank our speakers today, I have a few quick announcements. Thank you to our in-kind sponsors, KRVN 91.9 Radio, PAC Info and Simplified Computing, LLC, Dotson's Photography. And a special thank you to public radio station KLCC FM 89.7 for airing City Club programs on Mondays at 7. Our programs are always available on our YouTube channel and on our Facebook page. If you are a City Club of Eugene member, you can ask a question at a future taping of our programs. If you're not a member, well, you should be. You can join and then participate. More information is on our website, cityclubofeugene.org. And for our program on July 30th, we look at the therapeutic benefits of nature and wide open spaces with our program, Prescription Nature, Can Time in the Great Outdoors Save Your Life? That sounds interesting. More details and information about future programs can be found online at City Club's website, cityclubofeugene.org. Now I would like to thank speakers for a great program. So thank you, Alyssa Chatterjee and Cindy Bellamy and Cheryl Henderson. This concludes today's program. Hope that today is good for you all. Bye.